Very much for your time. It's good to see you.
Thanks for having me on your show.
It's my pleasure. So you keynoted an address here in Albany for the family planning advocates, actually, and this is actually to mark Women's Health Week, which is a national event. Your work has been primarily around women's health, reproductive rights, and specifically when it comes to communities of color. So at this moment is an unusual time because we are talking about abortion rights in a way that we really haven't for years. Are you surprised that it's again pushed to the forefront?
I'm never surprised that people are concerned about abortion rights, both those of us who support a woman's right to make her own choices and those who would try to prevent us from making our choices. It always comes up in an election year or right before an election year as the opponents to abortion try to use it as a way to arouse their base, and then we have to respond because we don't want to be caught blindsided by the fact that on any other bill, whether it's the deficit or the Wall Street bailout, somehow abortion always seems to come up.
Right, but this time actually, I mean, so you're talking about the defunding specifically of Planned Parenthood, and that seems to be a rallying point at a time that we hadn't really heard that before, not for a while at any rate.
Well, I believe that the overreach by those who would like to defund Planned Parenthood and really having an impact on all of Title X clinics, of which there's, over 1,000 Title X clinics that are not Planned Parenthood, is really a bad move by the people who are opposed to women's rights, because you're talking about cutting out access to breast cancer screening, STD screening, all kinds of reproductive health care, and you're really sending a signal that you don't care about women's lives and you're willing to sacrifice women's lives on the altar of your self-righteousness. And I think they're going to get a backlash for that.
But that message, it's interesting because, of course, obviously we've spoken to a number of advocates, but the message is not getting out somehow. In fact, what gets out is you shouldn't use taxpayer dollars to provide abortion services. Well, actually, they're not used to provide abortion services in this particular case. And yet the message that the money is actually used for cancer screenings or for mammograms is not getting through. And why not?
Well, I think part of it is because they're very good with doing one-liners that are not necessarily true, but through time and repetition they can make sound pretty convincing. But also I think there's a certain amount of laziness by those of us who convey these messages, because every time a lie is told, even the reporter should say, well, that's not quite true, so that the truth is also given an opportunity to be out there. But when we keep repeating their frames and their lies, even as a neutral party, then it gives it legs that it really doesn't deserve. No taxpayer dollars are being spent for abortion coverage right now, but you wouldn't know that from the discourse that's taking place. So we have to raise our voices louder, but we also need help from people in the media to say, that's not quite true, though it's a great one-liner for you.
Can you talk specifically about why this issue actually is a little bit different when it comes to communities of color? I mean, in New York, for example, there were a couple of firestorms in recent months. One had to do with remarks that were made by a number of people regarding the high incidence of abortions among the African American community, and then also we had an incident that your organization was involved in that had to do with a billboard. So let's take the first one first, which would be the rates, the abortion rate.
Well, what we have in communities of color in general, and black communities in particular, is disproportionate lack of access to preventive services like comprehensive sex education and birth control. So we end up with a higher rate of unintended pregnancies, and then we have a higher rate of going to public abortion clinics in which we have our services. So that means that a lot of abortions that are obtained by people in private offices aren't in the reported rates, and so we look like we just have this overwhelming number of community of color, women of color, having abortions. So the statistics are actually always misleading. But still, we do have health disparities in terms of access to reproductive health care, access to sex education, access to preventive services like contraceptives. I mean, we passed a bill permitting emergency contraception and then made it unavailable for women 17 and under. So we actually have a whole set of social policies that perpetuate some of these health disparities that we really need to address. Now, regarding the what happened in Soho, we had this anti-abortion group called Heroic Media erect this billboard in Soho claiming that the most dangerous place for an African American child is in the womb.
Right.
And Heroic Media, which also supports Sarah Palin, finds it hard to persuade us that they're really concerned about the African American community or our babies. But they put up this billboard in New York City. It only stayed up 48 hours because, oops, they forgot to ask the child's mother for permission to use her photo in an anti-abortion ad. So she's now suing the guy for misuse of her daughter's photo.
But what you believe, you actually believed that that billboard was really less about abortion rates and more about what exactly?
Well, it feels to the average black woman like an assault on our human rights and dignity, as if we cannot be trusted to make the decisions that are right for ourselves, for our families and our children. To claim that the most dangerous place for a child is in a black woman's womb sends a whole lot of coded messages, as if we are not good mothers, as if it's dangerous for us to be pregnant, that some outside force should intervene for the protection of the child. I mean, it's got a whole bunch of not so subtle messages that to black women are very offensive, because our question as breeders, our status as breeders in America has been contaminated since we have arrived in this country. So for a white guy to call that into question again and act like he's now going to be the protector of our womb is really deeply racist and offensive. And so we've been fighting those billboards all across America because we're offended by the assumption that black women cannot make decisions and choices that make sense for them.
Well, but just to play devil's advocate, what about the issue of First Amendment rights?
He has the First Amendment right to be racist, and we have the First Amendment right to call him racist.
Ms. Ross, I think we will probably end it on that well said moment. Thank you very much for your time. I really appreciate it.
Thanks for having me on your show.